My name is Kyle Cole. I'm 29. I turned 30 in about a week. I enjoy playing the guitar. I'm an avid outdoorsman. Love spending my time outdoors. Currently work full-time at a air ambulance company, so we transport patients from place to place, so it's been quite fulfilling to be on this end of things. So the first time they spoke to me about transplant, I was actually hospitalized after a pulmonary embolism, which is a bleed in the lung, and I couldn't stop coughing up blood and so on and so forth. And the transplant coordinator met me in the hospital after they'd done the procedure to stop the bleeding, and that's when transplant came up. They said I was a potential candidate, that it was in my near future, that I needed to think about that as a viable option in the near future because it was something that was going to come up quickly. So that was the first time I heard about it. So my quality of life before transplant and before the evaluation wasn't necessarily good. It wasn't necessarily terrible either. I was still active, still worked. I still worked out every day, exercised regularly, and but the quality of my breathing and the enjoyment I got out of life really wasn't as best as I hoped for. I spent a lot of time, not walking as fast as I would like to, or I couldn't run necessarily. So some of the exercises I was trying to do at work or at the gym, I couldn't necessarily keep up. So it wasn't all bells and whistles, but it wasn't terrible. So at the time, I didn't really have that much information on transplant. As soon as they told me that I might be needing a transplant in the near future is when I did most of my research. So I went back and looked online at success rates at different facilities, different outcomes, and what it all entailed. And I really didn't have that much information beforehand, before going into the transplant. So my family reacted to the idea of a transplant pretty fairly. They weren't against it. They actually were completely on board for it. I was the one against it. I knew that's a last resort plan. That's the last thing you want to happen. Just because it's life or death, and it's right there in front of you. So you have to pick life or pick death. If you don't choose to have a transplant, that's it. But so my family was on board for it. They wanted it to happen, and they knew from the get-go that I needed it. So they were totally for it. So I was only evaluated once at one facility. I was sort of in the process before transplant actually happened of inquiring another facility, maybe getting put on their list, but that actually never happened, and I was only evaluated once for the transplant. So the decision to choose a facility to do the transplant wasn't that hard. It was mainly based off my proximity to the facility, being only 45 minutes from the facility that did the transplant. It was pretty easy for me to decide, I should probably go here just due to the response time that you're from the call to the time you have to be at the hospital. So there weren't really any significant changes before transplant that they wanted me to alter, in my day-to-day activities necessarily. Basically just to not go out of the country during this time from the time you're listed. They don't want you, exploring out too far, so that way if you do get the call, you're not that far away for your response time to show up and have the procedure. In terms of diet and all the daily activities, there was really no change. They wanted you to be actually more active and try to stay as healthy as you can and keep up with your treatments. So the decision to move forward finally with transplant actually came to me when I was in the shower and I was struggling to breathe just to take a shower. To brush my teeth, it was very difficult, and you can imagine that's a very simple thing that everyone does every single morning. And it was getting to be difficult for me just to even stand up and, endure the brushing of my teeth. So that was ultimately the decision. I was like, I have to do this. If I don't do this, then ultimately this is going to be the end. So that was kind of a wake-up call for me. So my support system was, or still is, pretty huge. I have a really big family. Everyone was on board, especially leading up right to the moments before transplant. Everyone reaching out, showing encouragement, saying you could do this, you got it, it's no big deal, you'll get through this, you'll come back stronger than you've ever been. It's going to be such a fantastic thing to be able to breathe finally like a normal person. So the support system was huge. Everyone was there during the evaluation process, before and after, during. So, I had a very large support system. So the timetable from the first conversation to the actual transplant, I want to say was about 6 to 8 months, from what I can remember. I mentioned the pulmonary embolism. After that hospital stay, I also had had contracted hospital staph in my lungs, which caused my functions to drop significantly and very quickly. So it wasn't long after that, and that's why they knew transplant was in my near future. It wasn't that long after that first discussion that I was on the table. So the day that I got the call for transplant, I was driving to the DMV, I believe to get my license updated or to get my address changed or whatever it was at the time. And I was going down a 4-lane highway and caught myself because I got a call from a number and it wasn't expected, and because they told me what number they'd be calling from, and I saved it in my phone. And I got this call, it was a random number, I almost didn't pick it up. And when I did, they said, "Kyle, your lungs are ready. How quickly can you get here?" And I found myself pulled over in the median, in the middle of the road, just stopped. And I just couldn't believe it. I was in shock, basically. And I actually told them I'd have to call them back. I said, "You got to let me think about this for a couple minutes and I'll have to call you right back." Because it was just so shocking to me. And it's one of those decisions that, this moment right here is going to change the course of my life. So I know for some people it's different, but for me, that's how it happened. And, I called my sister and I believe my dad and was like, "Hey, they have the lungs, they're ready. What should I do? What should I tell them?" They're like, "Let's go." They're like, "It's time, let's do this." So I thought about it for a few minutes, called them back. I was still sitting in the middle of the road, called them back and said, "All right, let's go." So that, it was just a shocking experience, and it was all surreal, I guess, if you want to call it that. So waking up after surgery, you're on a lot of pain medication, so I necessarily don't remember the exact details as soon as I woke up. I really wasn't in a lot of pain. I just, waking up in the hospital bed with every single tube you can imagine coming out of your body, it was shocking. And, I really didn't know what to think. You kind of freak out a little bit inside your head. And but once you realize what's going on and, your whole family's there, you realize what happened and what's going on. But it sort of takes a little bit of time to understand really what's happening. But it wasn't painful necessarily. There was a couple, times that it starts to get painful, but you're on a morphine drip, or I was on a Dilaudid drip. So I just, you pump it every time you start to feel pain. So that was pretty much maintained throughout the recovery process. There was some difficult nights afterwards, but overall, it wasn't as painful as people think it might be. It wasn't like intolerable, but it was definitely a change in your normal hospital stay and having a tune-up or whatever it may be. It's a lot different than that. So there were a few complications after transplant. The majority, or the major one, being the bowel obstruction, which is caused by being on so many pain meds that it slows everything down and you're not able to pass anything. So once that happens, they try to give you enemas. They try to give you everything to make you go to the bathroom. Just wasn't working. So I spent a long time in the hospital. That was the most painful part of the whole process. It got to the point where I was screaming for surgery. Down the hall, I called for my doctor and I was screaming at him to get me into surgery. And finally, Dr. Hack, I believe, came in, just took one look at me, said, "Get him into the OR now." That's how bad I was off. My stomach was bloated. It was insane how painful it was. They wheeled me down, had the surgery. So after the transplant, I finally recovered and got out, but I had a colostomy bag for, I think, 3 months post-transplant. And I did have the procedure reversed later down the road, so everything worked out, but that entire process was way worse than transplant. So adjusting to transplant life afterwards, treatments and medications changed a little, or actually drastically. I'm on a lot of immune suppressants, anti-rejection drugs, but realistically, taking pills is not that hard for a CF patient to only have to take pills. Being used to doing medications, Pulmozyme, Toby, all the different treatments you have to do, the CPT, all that goes away. And, there may be some instances where, they're put on albuterol, something temporarily in terms of, airway clearance and medications in your lungs. But taking pills is a walk in the park compared to the previous, life with CF. So adjusting has actually been better and easier than the previous, walk of life. So my health and quality of life after transplant has been tremendous. About 9 months after I had the transplant, well, first I got a dog a little bit shortly afterwards, but then I got married, got started a new job, graduated college, and all that stuff happened within probably a year of having the transplant. So it was quite exciting, and it was like being on a rocket, it was everything happening at once. And now everything's kind of settled down, I have a full-time job, and this quality of life, breathing, doing things outdoors, going places, it makes things a lot easier. And dealing with, or not dealing with all the treatments and everything else you have to drag along. For instance, if I go spend the night somewhere or stay over or want to go, on a weekend trip, I don't have to drag the nebulizer, all the stuff that you have to take, after transplant. So it's been a lot easier in my opinion, and the quality of life has gone up tremendously. So the only thing that I wish I'd have been told before transplant that I wasn't was the fact that I was not going to wake up and automatically have an FEV1 or a lung function as high as I had hoped, or as high as someone that's had never had a transplant or never had CF has had before. So when I came out of surgery and had my first pulmonary function test, PFT, I believe it was around a 40%, maybe 40, maybe 50%. And I was expecting it to be over 100, like someone normal would experience. So I was disappointed. I guess that took the wind out of my sails because I was expecting a complete turnaround. And the fact that it wasn't was a little disappointing, but everyone's different and everyone's recovery process is different, and it could be longer than others. So it did eventually go back, it did eventually climb, but it still never got above 75, 76%, which I mentioned was my highest FEV1, even having CF. So that's pretty much the only thing that I wish I would have been told, that, don't expect your function to come out to, over 100 right after transplant. It might take some time, or it may never get there. Because that's exactly what I was expecting right after, having a new set of lungs. So if I were to do it all over again, I would definitely have another transplant. And one thing you have to keep in mind is there's always a potential for even a second transplant. So after your first one, it's still not technically the end of the road. So if you take care of yourself and do what you're supposed to do, stick to your regimen, and you do happen to fall into rejection or get sick, there still is a potential for a second transplant. So you always want to have that, as a backup for a potential second transplant. So even after my first one, even right now, I would still do a second one. So a couple pieces of advice that I would give to a potential transplant recipient would be to take care of yourself before it becomes an issue. If you go through life and you exercise and take care of yourself, and I haven't always been the best person to follow, but I have always stuck to a workout regimen. I've always eaten everything in sight, because that's something with CF you have to eat as much as possible. Take your enzymes to keep your weight up. So if you take care of yourself before transplant, that will give you a much better outcome after transplant. It gave me the strength to get through the first transplant. I mean, I dropped down to 95 pounds when I was discharged from the hospital. I was skin and bones. But the fact that I worked so hard at trying to stay healthy is what got me through that. Because if I'd have went into transplant being too sick or, a little bit underweight from what I was, then it could have been, that could have been the end. So I just would say to stay as healthy as possible. Definitely research and look at your different options before going in head first to the idea of transplant. There might be some other options out there that might prolong the transplant, such as new drugs coming out, new medications you could possibly take to prolong the process and postpone the transplant. So definitely stay on top of your research and stay healthy. So transplant changed my outlook on the future drastically. Before transplant, especially growing up with it, being a young kid and in my teenage years, it was one of those things, I'm living in the moment, live every second as if it were your last. That was my mentality. And, it's not the best attitude to have. It's a great attitude in the moment, but as far as your future goes, you don't want to necessarily just throw your life away, thinking it's going to end tomorrow, which is, growing up, that's what I was told a lot. I wasn't going to live till I was 18. Wasn't going to live even at the time when I was 7, 8 years old till I was 12. And eventually, they told me I wasn't going to live till I was 18, surpassed all those numbers. And once you do that and get to a point in your life where the transplant is, an option that's on the table, afterwards, it's completely changed my life, and the trajectory of my life is completely gone up. So, like I said, I got married, graduated college. So right after transplant was like a fresh start. It gave me, hope and thinking that I would have a future. And previously, I'd never considered it really.